We have patients here today who are going to benefit from the expansion of the Medicaid program, and they are over to my right. Oh, right here. Today I'm here to sign an executive order, and as you might have imagined, it's my first, to expand health care to hundreds of thousands of Louisiana working families. Because of the previous administration's refusal to expand critical health care services, low-income adults suffered without health care because they were too poor to qualify for subsidized care on the health insurance exchange, but made too much money to qualify for Medicaid. We are consistently ranked one of the poorest and unhealthiest states. This cycle will not be broken as long as any Louisianan has to choose between their health and their financial security. We do not want to continue to send our federal tax dollars to Washington to then be given to 30 other states to help their people who need access to quality health care while ours go without. We want to bring our federal tax dollars back home to Louisiana to help us ensure healthier outcomes for our people. This executive order is but the first step in a new and better direction. Expanding health care means that once expansion is up and running, adults who would not otherwise qualify for Medicaid and who make at or below 138% of the federal poverty level are eligible for health insurance coverage under the Medicaid expansion. What this means is that adults who make up to $16,242 a year as an individual, or up to $33,465 for a family of four, would be eligible for Medicaid coverage. By July 1st, we expect more than 300,000 hardworking citizens will have the comfort and security of health coverage. This will not only afford them peace of mind, but also help prevent them from slipping further into poverty and give them a fighting chance for a better life. It's also the fiscally responsible thing to do. Already, by failing to expand Medicaid under the previous administration, Louisiana has lost the opportunity to receive over $3 billion in federal health care funds. With Medicaid expansion, Louisiana could realize additional state general fund savings of over $100 million through fiscal year 20. Beyond that, Medicaid expansion will help to lessen Louisiana's budget crisis and will keep more of our federal tax dollars here at home. Most importantly, Medicaid expansion will provide access to quality health care and result in significantly better health outcomes for the working poor. And while we focus on the individuals who would benefit, because that is truly the most important thing, our providers also need to make sure that to the maximum extent possible, when they provide care, that they are reimbursed for that care. And if that's not going to happen, through the Medicaid expansion, when the DSH reductions happen, and as we all know, DSH reductions is the primary way that we fund the safety net hospital system, there is no way to make sure that these providers stay open and solvent and strong enough to take care of people who come through their doors, whether or not they are poor, uninsured, on Medicaid, or otherwise. So this is also a step in the right direction to make sure that the providers remain able to take care of the citizens of Louisiana. I am very thankful to Dr. Gee for her commitment to equal opportunity for health care coverage and the assertive role she has already played within the Department of Health and Hospitals in prioritizing and ensuring the success of this expansion. And as far as I'm led to believe, now is the time to sign this executive order. It's going to be over in just a minute.
It's going to get better.
Thank you. I want to thank the many members of the legislature who came up today to be present for this event. And at this point, I believe that it is time for a few questions. Sue Lincoln.
Governor,
It'll be a topic of discussion as he and I visit Wednesday night, tomorrow night. And so we will discuss it, because I will be asking for as much cooperation as possible out of the Health and Human Services in Washington, which I've already had a visit up there, and Secretary Burwell has assured me that it will be forthcoming. Yes, sir. I don't suspect there will be a few members of the House who will try to do that. I don't believe they will be successful. There was not a single campaign promise pledged to the people of Louisiana that was more integral to my campaign than expanding the Medicaid program. I let the people of Louisiana know why I wanted to do it, why it was in everyone's best interest, why it was simply the right thing to do. Following that discussion, I got 56% of the vote. I believe we will have the Medicaid expansion in place come July 1st, so that these individuals that we've been talking about here today will have that Medicaid card and they can access services through their provider. Yes, ma'am. Well, first of all, I hope that everybody, no matter what avenue they have at their disposal, will find a way to get health insurance coverage. It's just too important in 2016 for individuals not to have it, especially if there's a program out there that allows them to have that coverage, and the security and the peace of mind that comes with that. They should be followed by better health so that they can be more productive citizens, better workers, and have a higher quality of life. So I certainly would hope so. I have no idea whether this instrument will actually encourage that particular universe of folks. First of all, this executive order allows DHH to go through the normal rulemaking process to exchange the eligibility with respect to the federal poverty level to 138%. We will not ask for waivers initially, but there will be waivers that we will ask for as a follow-up, which is a way that we can go about moving forward in the meantime, but getting the waivers after the fact. I can't speak to fast lane methods. I can only tell you that Dr. Gee already has a plan in place to bring on the folks that we need and the consultants that we need, the technology that we need. Not only does she have the plan in place, we know what the price tag of implementation is going to be in the current fiscal year, and she has already secured pledges from providers to cover the state's portion of that cost. So that for the remainder of this fiscal year, there will not be a net cost increase to the state of Louisiana to prepare for expansion, which will occur on July 1st. The cost is borne by the federal government for the rest of this year at 100%. It gradually steps down to 90%. 90% is better than any match rate we get for any other program for health care. And you have to remember what I said earlier. It isn't as if maintaining the status quo is even possible. When the DSH reductions happen, and they will, there is no way to deliver health care that doesn't have the Medicaid expansion as a critical component of our plan. And in fact, the business plans of hospitals around the state, and especially the partner hospitals who are running our charity hospital system, our safety net hospital system, I should say, they also call for the Medicaid expansion. There is no way to make this work absent that. It is an aggressive timeline. If we don't quite get them all signed up by July 1st, it will happen very soon thereafter, but that is certainly the plan, is to have this ready by July 1st. The 248 additional workers will cost the state an additional $1.3 million this year because of the enhanced match that we get from the federal government to do the implementation. The entire cost to the state of Louisiana is about $2.8 million, but that includes everything that's required for implementation, to include new technology and that sort of thing. That $2.8 million is what I'm talking about. We have pledges from providers to cover that cost for the rest of this fiscal year. the providers that have agreed to do this, and we'll get you that information as to who they are.
Just quickly, it's called outstationing workers. So what they do is they write a check to us, and then the state pays the salary of a worker who will be in their facility. So that way people can get enrolled into health care right there where they're getting care. You go to an ER, you can enroll for insurance there if you're underinsured or uninsured, instead of having offices separate. So it's something we need to work out with the federal government, but basically it's an in-kind it's a donation of money towards the salary of folks who will be enrolling people in health care.
Well, first of all, I believe government has a role to play in improving people's lives. I happen to think it's a conservative thing to get the benefit of your tax dollars. Right now, we're paying tax dollars to Washington that would cover working poor in Louisiana with respect to the Medicaid expansion that are not coming back to Louisiana. So they're not benefiting our working poor, nor are they benefiting our providers. And so there is nothing more conservative, in my opinion, than making sure that when you do pay taxes that you get benefit from that. Secondly, with respect to the general philosophy, I will just tell you again, this is no secret to the people of Louisiana that I was going to be elected and expand the Medicaid program. And in fact, all 4 major candidates running for governor expressed some support for expanding the Medicaid program. So I don't look at this as some revolutionary thing. This is just simply the right thing to do. And there are 30 states that have done this. 14 are presided over by Republican governors. This is not a partisan thing either. This is not right versus left. This is right versus wrong, and today we got on the right side.